We already discussed about the febrile seizures. Now we will discuss lavender fever, special epilepsy syndromes, Dravet Syndrome, GEFS plus, and FIRES. What are they? Typically, febrile seizure window is 6 to 60 months of age. Now, regarding the febrile epilepsy syndromes, the red flags are the age of onset, that is the outlier, less than 1 year or more than 5 years. Then the duration of the seizure, more than 15 minutes. Features mainly focal in onset or unilateral. Clinical signs are mostly present. And frequency is multiple times or recurrent episodes within 24 hours and recurrent in clusters. For the Dravet syndrome, severe myoclonic epilepsy of infancy, the age of onset is less than 1 year and the features are focal in onset, unilateral, clinical signs are present. For the Dravet syndrome, initially onset less than 1 year of age and the features are multiple focal onset or unilateral signs from myoclonic seizure, atypical absence, many others. Now for the GEFS plus, that is generalized epilepsy with febrile seizure plus. It also appears in the infancy and there is the frequency is increased like multiple episodes, recurrent episodes within 24 hours period. Now FIRES, febrile infection related or refractory epilepsy syndrome. It usually occurred in more than 5 years of age, that is 6 years onward, and there is the frequency of the seizures are multiple time, recurrent episodes of seizures, febrile episodes of seizure, ultimately leading to difficult to treat refractory seizures. Okay, now let's discuss it into details. Dravet syndrome, severe myoclonic epilepsy of infancy. The stage 1 is the febrile stage, usually characterized by prolonged focal or unilateral tonic seizures occurring every 1 to 2 months, triggered by fever, heat, but different from usual febrile convulsions by being prolonged and frequent. It started in infancy with febrile seizures, status epilepticus, and hyperthermia sensitivity. Stage 2 is the worsening phase, where the seizure threshold drops to lower fevers. Even without fever, there is emergence of various types of epilepsy in this phase. It usually started after 1 year of age. Myoclonic seizures, complex partial seizures, atypical absence. Also, acute encephalopathy occurs in this period. And developmental delay already started after 12 months of age. Then it gradually increased in the later life. Stage 3, stabilization phase. In this phase, severe motor and developmental delays become evident. There is also appearance of ataxia, obtundation status, and crouching gait is also present. The chances of sudden unexpected death in epilepsy is compared from the first stage to last stage in the Dravet syndrome. Dravet syndrome is the most severe of the phenotypic spectrum of the febrile seizure associated epilepsies. Now the SCN1 spectrum, GEFS plus versus Dravet syndrome. In the Dravet syndrome, there is loss of function variant in the SCN1. 80% of the Dravets are de novo pathogenic variants. And there is also genetic variants like SCN1B, GABRG2, SCN2A mutation are causing Dravet syndrome in very less percentage of patients. And in some percentage of patients, cause is not identified. There is a term called Dravet syndrome spectrum or SMEI borderland. What are they? They are the severe milder variants of Dravet syndrome that manifest some but not all the features of the Dravet syndrome we are discussed. Dravet syndrome spectrum. Now in the GEFS plus, there is also a CN1 gene mutation but there is some function of the SCN1 gene present, milder than Dravet syndrome. In the GEFS plus, it is mostly autosomal dominant, often inherited from an unaffected carrier parent. It is of milder type. Phenotypes are highly variable, begin in the early childhood, in the infancy, but mostly resolve within the mid-childhood. Okay. There is multiple episodes of febrile seizure that turn into the afebrile generalized seizure, tonic-clonic absence or myoclonic. Next, what about the vaccine encephalopathy? The myth is timing mistaken for causation. Historically, many Dravet cases were misinterpreted or misdiagnosed as vaccine encephalopathy because the onset of severe seizure and encephalopathy frequently coincided with the infant vaccination schedule. In the reality, there is genetic determinism. Molecular testing reveals the true driver, a de novo SCN1A pathogenic variant, and the disease trajectory is dictated by the genetic loss of function, entirely independent of the vaccine itself. FIRES, febrile infection related or refractory epilepsy syndrome. Febrile infection related or refractory epilepsy syndrome. It is occurred in the more than 5 years of age, predominantly male. It is previously healthy and neurologically normal. There is a trigger of infection, suddenly occurred features like encephalitis, like illness, but no identifying organisms are found. And the outcome is very severe. Rapid descent into refractory status epilepticus, difficult to treat chronic epilepsies. So when male baby, 6 years old male baby, apparently well and neurologically normal, then sudden one fine morning he has some fever episodes and suddenly figurated into encephalitis like symbols, and it may lead to the FIRES and refractory difficult to treat epilepsy may result. So FIRES is a very devastating condition. Now diagnostic synthesis methods. How to differentiate the Dravet, GEFS and FIRES. In the Dravet, very severe form, target age of onset less than 1 year in infancy, peak in the 1 year, genetic mutation in SCN1, loss of function mutation, initially prolonged hemiclonic seizures, then appears in recurrent clusters. Ultimately, multiple types of seizures occurs and long term there is severe motor and developmental delay. In the GEFS plus, appearance in the early childhood or infancy, genetically there is also SCN1A mutation and autosomal dominant inheritance is seen. In the initial seizure profile, simple or complex febrile seizure starting with, later it become febrile or generalized. And in mid-childhood, remission may occur. So long-term outcome is variable, often normal cognition with manageable epilepsies. And in FIRES, more than 5 years older children, usually male, unknown etiology, and mild fever progressing into a rapidly refractory status epilepticus. The long-term outcome is very grave, severe encephalopathy and difficulty to treat epilepsy. And there is another entity called focal seizure plus epilepsy variant, in which the seizures are focal rather than generalized. As discussed in the GEFS, multiple types, and Dravet also multiple types, and FIRES is also multiple types. But in focal seizure plus epilepsy syndrome, there is only focal types of seizures present. So that's all for today.